2013, I was diagnosed with an autoimmune disease that required monthly infusions to keep under wraps. And when we were switching to self-fund health, that gave me significant trepidation about taking care that I've received through big box medicine for 10 plus years. And then now going to a whole new environment of how is this going to work? Are they going to understand my case? How is scheduling going to happen? And upon my first visit to the infusion center through self-fund health, that all went away because they have all the same equipment as big box medicine would. The scheduling, though different, is perfectly seamless. And I've got text notifications prior to my appointments. The next appointments are scheduled right there for the rest. The next 3 are all mapped out on my schedule. It's not, well, we might have this one in 6 months and it's on a day that doesn't work for you. It's what works for you, and we'll make our schedule work for you. And that's been a huge relief. And I haven't even talked about cost, but the cost at big box medicine for these infusions was huge, to where I would max out my out of pocket in January of every calendar year and still have a family of 4 to consider throughout the rest of the year. I was shocked, frankly, at the cost difference of between medical fees at using hospital facilities at big box medicine and all the surrounding issues around it, not just the medicine, the pharmaceutical medicine you're receiving, but all of the other ancillary fees that go along with the big box medicine structure. Those kind of all just fell away through self-fund health, and you're getting directly to that provider at a cost that is not breaking the bank for every other medical need you might have throughout the year. So earlier this year, we were at an offsite training where I injured my knee and actually tore my LCL on the outer side of my knee. Couldn't walk. Had to skip dinner the last night of the convention, and so I'm out of town and I'm calling self-fund health. So I got to figure this out when I get back. And I think this was on a Friday. On Monday, I had an MRI scheduled, local MRI scheduled at no cost, mind you. And I'm thinking MRIs probably take weeks to get in. And after that, seeing a surgeon is going to take another week or month or so. This is going to be awful. So I got an MRI on the Monday I returned. That same week, I had a surgical consult right next to work, which was perfect. And I was in a PT program shortly thereafter at no cost to me. I've been dealing with nasal blockage for years, and it's always something that has just been, I'll handle it sometime down the road, it's no big deal, but with athletics and my lifestyle, I'd want to get as much breath in as I possibly can, and I just wasn't. And so what do? I went to my local healthcare provider and said, I think I have a deviated septum, and self-diagnosed myself, went in there, met with an ENT, and sure enough, deviated septum. And so they put me on the surgical schedule for a couple months out, and that was it. I went home thinking I had solved the problem, and we'll wait to do that. Well, in the meantime, our nurse navigator called me, seeing that I had that scheduled, and said, would you be open to other alternative methods to solve this problem? We've had success with this with even other coworkers in your organization. Would you be willing to meet with this other ENT specialist? Well, sure, I would. I was never told of any other alternatives, and so what can it hurt? And I've got a couple months before that surgery is scheduled anyways. So I went into that ENT specialist and was educated on a breadth of other alternatives to solve the same problem in a quicker time frame, with less recovery time, and at a significantly lower cost. And so I decided to investigate that avenue, and it was an outpatient procedure that got me to where I should have been based on what the ENT with the septoplasty, he told me where I'd be. I'm there 6 weeks out of that procedure with very little downtime, and the recovery was pretty easy compared to what I've heard of horror stories of going under the knife with a traditional solution for that problem.